Alright everybody, my name is Evan. This is my quick presentation on joints, and I will apologize now for my shaky hand and recording this on my iPhone. But we'll get started. So, we'll start with what is a joint. And a joint is the articulation of two or more bones which allows various types of movements. And the extent and the type of movement determine the name applied to the joint. Pretty straightforward. And we move to the differences in joints. Some joints, which are also known as arthroses, have no movement, some have very little movement, and others are freely movable. Which is pretty easy. We have all three, which are located in the body, and that's what we're going to talk about. But before we talk about it, we got to talk about how they're classified. So the classification of articulations, or joint movements, may be divided into structure or function. Now, when we think about structure versus function, we can classify joints by structure into one of three categories. And these are either known as fibrous joints, cartilaginous joints, or synovial joints. If we classify them by function, it also results in three categories, funny enough. But that is synarthrosis, or synarthrodial joints, amphithrosis, or amphiarthrodial joints, and lastly, diarthrosis, or diarthrodial joints. But since there's such a strong relationship between structure and function, the two overlap a lot, and we can kind of make the classification systems a little bit easier. And by doing that, we just have to pair them up. And if we pair up the categories of structure and function so that we have more similarities and differences between the two, we get the following pairs. So, we have the fibrous joints paired up with synarthrodial joints, cartilaginous joints, and amphithrodial joints, and lastly, synovial and diarthrodial joints paired up. But for our purposes, the movement's more important, so we work more with the classification regarding function. So those are our last three there, synarthrodial, amphithrodial, and diarthrodial. So, let's do a quick run through all of them though. The synarthrodial joints, these are your immovable joints, and they're divided into two types structurally. We have one, which is the suture, which is found in the cranial bones, as you can see there on the left, and gymphosis, which are found in the sockets of the teeth. We move on to amphithrodial joints, and these are just slightly more movable than the synarthrodial. And structurally, they're divided into three types. Syndesmosis, which is a type of joint that's held together by strong ligamentous structures. An example of this is the corticoclavicular joint. Next type is the symphysis, which is a type of joint that's separated by a fibrocartilage pad. An example of this are the intervertebral discs, and as you can see there, we got a picture to the right, where the intervertebral discs are. And lastly, we have synchondrosis, which is a type of joint that is separated by hyaline cartilage. An example of this are the costochondral joints of the ribs with the sternum, so where they connect in your chest. As you can see here, the difference between the three are just the type of tissues and structures that hold the bones together. And now we move into diarthrodial joints, which are freely movable ones. They go all over the place. And since they are freely movable, their structure is slightly more complex than the last two, so we're just going to take a quick look at that. And we have many components of a diarthrodial joint and how it relates to movement, but I'm just going to name a couple of the big things here. We'll start off with the joint capsule, which surrounds the bony ends forming the joint. And as you can see from the picture there, that's that kind of pinkish part on the outside. So our joint capsule, it's outside of both the bones. Now if we look at the joint cavity, that's the area inside of the joint capsule, which has a thin vascular synovial capsule, and that secretes synovial fluid, which allows more movement, easy flow, more gliding between the bones. And that's our light blue area in the middle between both the bones. I also like to note that in some areas, the capsule is thickened to form ligaments, and these ligaments provide additional support between the bones. Not all joints have these, but it's good to note. And lastly, we have the articular ends of the bones. They have hyaline cartilage on both the ends. So that's about the middle blue, not quite the darkest one, on both ends of the bones there. This allows for more wear and tear, more stressing, with less chance of breaking something. So, we'll move into our arthrodial articulations here. And as we go through this, I got about 6 slides because there's 6 major ones. Just while you're watching, just try moving the joints around because you can't see them, but just notice the different ranges of motion, different planes of motion, see what the differences in the body is. So we'll start with one, our arthrodial joint, or I'll put the simple names on the side here too, our gliding or plane joint. And this type of joint is characterized by 2 flat or plane bony surfaces that butt against each other. And it permits just a limited gliding movement. An example of this would be the carpal bones of the wrist. As you can see, we got the picture there. Those are your carpal bones with the green arrow. And to move this type of joint, just stick your hand out, kind of like what the picture's got, and rotate your hand up, and then back down, like you're waving goodbye to somebody. And this movement is what uses this arthrodial joint, your carpal joint. Next we move on to the condyloidal joint, which is our ball and socket joint. Biaxial, because there's 2 ball and socket joints in the body. The biaxial means that it allows movements in 2 planes without rotation. An example of this joint are the 2nd, 3rd, 4th, and 5th row of the metacarpophalangeal joints, which is a really big, long, expensive way of saying these are your fingers, everything but your thumb. To use this joint, just try laying your hand out flat, spreading your fingers apart as wide as you can, bring them back together. This movement is the abduction or adduction of your fingers. 1 plane of movement on there. And if you curl your fingers towards the palm of your hand, like you make a fist, punch somebody in the face, straighten your fingers back out again, and you're using the flexion extension at the metacarpophalangeal joints. And that's a totally different range of motion than what you just used for your abduction and adduction. Alright, we have our arthrodial joint, which is also a ball and socket joint, but different than the last one because it's multi-axial. And this is the most like a true ball and socket, and it means it permits movements in all planes. And one of your easiest explanations of this one is your shoulder joint, glenohumeral joint. And to use this, just get some room around you, try not to hurt yourself or anything beside you. Just move your arm around across your chest, back a little bit, do some arm circles. And as you can see, it moves in all 3 planes, nothing stopping it. Just the limited range of motion based on everything stabilizing the joint. Alright, now I apologize because I'm going to say this wrong, and I know I will. But this is our ginglymus joint, or hinge joint. And this is also a joint that has a wide range of motion, but unlike our last one, it only has movement in 1 plane. So, one easy description, if you just got a second, just stand up, balance on 1 leg, and then using your tibiofemoral joint, or your knee joint, just use flexion or extension. So bring your foot up towards your butt, back down again. And as you see, your foot moves a long ways, which means there's a very large range of motion there. But you can't move your foot from side to side without rotating at your hip. Your knee doesn't go side to side. So this is what it means, it only has 1 range of motion, or plane of motion, sorry. And next we move into our sellar joint, or a saddle joint. And this joint is only found in our thumb. And it's a ball and socket joint again, but it has a little bit of rotation in it. So, to try this one, just open your hand up again, bring your thumb across your palm, trying to touch your pinky finger, extend it back outwards again, like you're stretching out all your fingers, and then you can move it in a bit of a circle. So this circle is where it says it's like a ball and socket, and you can move it in all directions, but your thumb rotates a little bit just while you're doing it. Alright, now we move on to our trochlear joint, or our pivot joint. And this is a type of joint with a rotational movement around a long axis. So, an example of this is a rotation of the radius on the ulna at the proximal and distal radio-ulnar joints. So, to try using the movement of this one, zoom in on the picture here. But start with your hand in a palm up position, which is supination, and rotate your palm over, as you see. Then you go into pronation. And since you can't see the bones actually moving, this is what happens in your forearm, and this is what I was talking about, where it rotates around the long axis. Okay. So I appreciate if everybody went along with me there, just kind of moving about, feeling the differences, different planes of motion, different range of motion, as we're getting towards the end here. So, since we have all these different types of joints in the body, lots of different movements, lots of different rotations, things like that, we're going to talk about the stability here, the mobility. So, easiest to talk about is that when a joint is more movable, then it becomes less stable. So if you compare your shoulder, freely movable, to the hinge joint in your wrist, then it's not a whole lot. Your shoulder, you can dislocate it, a whole lot easier to do that. But your wrist, you gotta have to apply a lot more pressure to break your wrist, something like that. So that's what I'm saying there. Opposite's also true. Less mobile it is, more stable it is. And you can easily just think about that with sutures. There's zero movement, so it's very stable. And there's 5 big factors to stability here. And so these 5 factors affect the total stability and consequently, the mobility of a joint. So, 1, we have our bones, which are usually very similar comparing between people. I mean, length could change depending on how tall you are, things like that. But the actual anatomical configurations at where the joint is between people could be very different. Next we have cartilage. So, which is the same sort of thing. The structure and the makeup of each bit of cartilage within the body, some people have more, some people have less. That'll make a difference whether the bone's more stable because of cartilage or not. We have ligaments and connective tissue, which, as you see, same sort of premise as cartilage. More ligaments, more connective tissue could mean more stable, more... What I mean, that could decrease mobility, but just something to think about. The muscles, which provide dynamic stability, so that's when things are moving, that's what keeps the joints going, everything like that. And lastly, we have proprioception and motor control. This means if you're aware of your body, whether you're coordinated or you can be kind of clumsy like me, and the more aware you are of your surroundings and what's going on, the more stable you're going to be. Okay, as we go into, and I kind of talked about already, we have some movement in joints, and in some joints, many different types of movements are possible, and we refer to the area at which a joint can normally and be painlessly moved as the range of motion, or as you'll see written a lot as ROM. So, measuring the range of motion, we use an instrument called a goniometer. And this has one moving arm and one stationary arm and an axis in the middle to help measure the degree of movement. So, to use this, you have the axis of rotation lined up with the axis of rotation on the joint. So as we see in the picture there, put the little circle on the side of the knee. The stationary arm is placed on the more stable bone. So in this case, we have the more stable arm on the femur, and the moving arm is placed along the axis of the moving bone. That's our last one there. So as you move your foot or flexion extension at your knee, depending on where you're laying, the joint angle can be read. Just to give everybody a better view here, this is what we've got. Yeah, and that just about sums up my presentation on joints. Just have our references here for our images, everything like that. And I appreciate everybody's time. Thank you.